Hi, I'm Amanda Olson from Intimate Rose, and I'm a doctor of physical therapy and certified pelvic health specialist. And I'm very excited to introduce you to the new Intimate Rose pelvic wand. And we designed this specifically to address some very specific needs that a lot of people with pelvic pain have. So our wand is covered in medical grade silicone, so it's really smooth and easy to both insert and remove. For trigger point therapy for tender points in the pelvic floor muscles. And the other thing is that each end can be used either rectally or vaginally. So depending on what your individual anatomy is like and what feels best to you, you can use the more blunt end here. You can see is about the size of my pinky. Or you can use this end that comes in a little bit wider and then has a little bit more of a specific point to it. It's still quite blunt, that you can see that it's not sharp at all and it's very smooth. But this just allows for a little bit of individualization of use of this nice trigger point wand. The other thing is it has a totally different shape to it than what you'll see on the market. And this allows the wand to get into deeper pelvic floor muscles such as puborectalis and obturator internus. So when you're thinking about pelvic floor muscles, if you're having pain that is deeper in, so if this is the urethra, the vagina, and the rectum here, and here on the deep layer, if your pain is further up here and you're coming in vaginally, so putting the wand in through the vagina, this is used to hook into these deeper puborectalis muscles. So that is a common place to have a trigger point in people that are having urinary urgency or pain around the bladder, and you've had all kinds of medical testing and they're clear and you don't have any bacteria or other underlying diseases in the bladder. It's really common to have a tender point right there in that puborectalis. Another one is obturator internus. So here, deep on the pelvic model, deep, almost close to the hip. This is a common place to have a tender point where it feels like it's coming from your hip or maybe coming from your groin, but it's very deep in there and you can't reach it and you can't stretch it. And maybe you've had a pelvic physical therapist do an internal pelvic floor muscle exam and put a finger on it and ouch, right there, that's where it hurts. So the trigger point wand is specifically meant to be able to hook into and reach those deeper tender points, and then certainly able to reach into the superficial muscles around the vaginal opening, around the urethra, around the rectum. And likewise, the wand can go into the rectum. Depending on what feels best to you, you might want to use this more pointed end, or you may want to use this thinner end here. And it can go right into the rectum and hook around to help relieve the tender points. There are several different ways to release tender points. Listen to your pelvic physical therapist or other provider if they've given you specific recommendations. In general, I tell people to, when you find a tender point, either with your finger or with the wand, to hold pressure as if you would be checking a tomato. So if you were going to check a tomato for ripeness, you would compress the tomato, but you wouldn't push so hard that you pushed all the way through the tomato. So you're pushing tomato pressure onto the pelvic floor muscles. When you find a tender point, move your leg in. You can move it in or out, so bringing your knee in across your body or bringing it out until you find that that trigger point stops hurting. And then when you find that point, so you move your leg in and you find, oh, okay, I feel better here. You're going to stay there for a minute or two until the tender point lets go or releases. And then you're going to release pressure and move on. So if you have been educated by a pelvic health practitioner, perhaps a pelvic physical therapist, that you have a trigger point in a certain location, you can go right to that certain location and release that tender point. You can also gently sweep around in through the pelvic floor to see if there are other locations, but you're going to avoid pushing too hard. So tender point checking is just like checking a tomato. It is generally best to use a water-based lubricant on the wand. Our Intimate Rose, Velvet Rose water-based lubricant is perfectly matched for our medical grade silicone, and that just allows for ease of the wand to get in and out of either the vagina or the rectum. I recommend you use at least a tablespoon. Just use quite a bit to make sure that it goes in nice and easy. And for more information or to purchase the wand, you can do so at intimaterose.com.